first thing I believe is there is nothing about U.S. healthcare that is patient-centric. What we really mean is what we want the patient to have or experience or what we think is best for them. And I think that's inherently important to understand and to like very much believe as a core belief before we could do anything. Because I think that's why we keep circling around just insanity. Is like, why is the industry the way it does? It's because we're not trying to solve for the patient in any way. And then I think the second one is that I think, like other industries, if we somehow solved for core problems that these patients are experiencing, that the first movers for there will run away with wild financial success.
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show. This is a mission, y'all. As builders and operators, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options might be right for you and your loved ones. Here's what's going down today. First up, we have the Flava of the week about the new Google Health app and Fitbit Air. Do Google's latest health products signal a battle for the consumer health operating system? And will they make good on the promise to make health and wellness personalized, preventive, and proactive? I'll talk about that. Then Aasim Saeed, the founder of Amenities Health, joins me to discuss the realities of building in the direct-to-consumer health space and his pivot to powering health system-based concierge and premium offerings. I'm Jared Johnson. Let's get it.
Flavor of the week.
Google's entering a new era of fitness and wellness with the launch of the new Google Health app, Health Coach, and Fitbit Air. Announced on May 7th, the 3 new products enable users to take even more agency over their health and provide continuous, proactive, and personalized guidance. First up, the Google Health app is an evolution of the Fitbit app. It brings together all of your health data from wearable devices, Health Connect, Apple Health, and your medical records into a single place. You can get a holistic view of your health and soon will be able to securely share your data with friends, family, and doctors. Existing Fitbit users will automatically get upgraded to the new app, and later this year, they'll begin migrating Google Fit users into the Google Health app. Second, Google Health Coach is a personalized health companion that was launched as a public preview last October. It's labeled as a fitness tracker, sleep coach, and health and wellness advisor. Starting May 19th, they're making it publicly available as part of Google Health Premium, formerly Fitbit Premium. Those plans start at $9.99 a month or $99 a year. And finally, Fitbit Air is a discrete, screenless tracker that's being framed as Google's counter to Whoop and Aura, but cheaper and more mainstream. It comes with 3 months free of Google Health Premium, and it's available in a variety of colors for $99 or $129 for the Steph Curry Special Edition. What's the consumer lens? This launch feels like it's more about Google trying to own the consumer health operating system, a low-cost data capture device, a unified health app, medical record ingestion, cross-platform integrations, and a premium AI coach. That's the real shift here. Google is moving from tracking health data to interpreting it. The opportunity is massive because consumers need help making sense of fragmented health signals. The risk is also massive because advice, trust, privacy, and clinical boundaries become harder. Much harder, in fact, once an AI coach starts explaining patterns from wearables and medical records. In the big picture, it's the latest chapter in the big health tech playbook that's being rewritten as we speak. As we connect the signals from Google and other big tech players since the start of the year, we can see where this is all headed. It's a battle for the consumer health operating system that incorporates fitness and wellness data in ways that finally start to make good on the promise to make health and wellness personalized, preventive, and proactive. Let's see how Google's new health apps will increase the market and impact that market for consumer-driven health and wellness, and where that all connects back to the care experience. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. All right, let's get into the flow. I'm here with Aasim Saeed. Aasim is the founder and CEO of Amenities Health and very well known in this space, and really looking forward to this conversation. Aasim, welcome to the Healthcare Wrap.
Thanks for having me. Excited to talk.
I think we can go a lot of different directions with our time today, but I think it's worth starting with a little bit of background about yourself. I've been starting to ask this question lately, and it's been really interesting to hear what people say to this. But if you had to boil down just your general approach or philosophy, like your beliefs about digital health, like how do you boil that down into maybe like one or two core beliefs?
Sure. So just so folks have 1 minute of background on me, and then I will get to those two that I think are a fantastic question. It made me think when you shared them. I'm a physician and public policy person by education, but instead of a clinical residency, I spent my formative years at McKinsey working with large healthcare systems, and then eventually went native and joined one of those. I used to serve as the head of innovation at Baylor Scott and White Health, and then recently launched Amenities a few years back, still working largely with large healthcare systems. So the reason I say that before I answer your question is there's a lot of bias around large healthcare systems, and that really shaped my first answer. So the first thing I believe is there is nothing about U.S. healthcare that is patient-centric. I hate when we use that term, patient-centered. What we really mean is what we want the patient to have or experience or what we think is best for them. No one hardly gives a damn about what the patient is actually looking for in any shape or form in this industry thus far. And I think that's inherently important to understand and to like very much believe as a core belief before we could do anything. Because I think that's why we keep circling around just insanity. Is like, why is the industry the way it does? It's because we're not trying to solve for the patient in any way. And then I think the second one is that I think, like other industries, if we somehow solved for core problems that these patients are experiencing, that the first movers for there will run away with wild financial success. And so we're trying to connect those two things, like this kind of acknowledgement and reality of understanding that we are not solving for patients currently. And that second one, which I think is also quite controversial, unfortunately, is that it is actually incredibly good business if somebody would to actually believe that and solve for it, as if, and this is a super hackneyed example, but like as if Amazon did with e-commerce first, like those core, like solve the problems of e-commerce for people, and then they kind of believe in the concept overall. So we'll get into more of that, but those are the two I think that are my answer.
Well, not only do they resonate with me, they really make me think, especially the part about how the second one could be controversial, which I agree with. And as I double click on that one a little bit, well, how does your point of view inform that? Because I think philosophically we could say that shouldn't be controversial, and yet it absolutely would be.
I think there's a half dozen, whether you call it innovation theater or virtue signaling trends in the industry. There's health systems that staff and recruit for patient experience officers. There's always a role like that is just, I think for folks that have been inside the industry for a while, that is a bit laughable, because those are, okay, set it and forget it roles. Now that we've done that, we've solved for patient experience, it's over. So I fundamentally believe that health systems do not believe that patients influence their business enough. The majority of, I think, healthcare has been directed under this idea that physicians direct traffic, and that the highest profitable service lines are the profit engines of the large healthcare systems. Cardiology, orthopedics, oncology, et cetera. Those things I think people are starting to understand. That's what drives the volume. Drives the profitability, and specifically in commercial patients. Now, I think what goes unsaid, though, is for the last 3 decades, it has been fundamentally true that there's really two very traditional levers on how do you win that market to become a profitable healthcare system or provider. One is be where they are, just location. Location. This is like McDonald's. Like Burger King goes and puts a Burger King on the corner across from McDonald's because they know McDonald's did all the research about the flow. Health systems do the same thing. They build hospitals in rich neighborhoods because patients don't like to travel far, and so that helps get commercial rich volume, right? The second, though, is networks of physicians. And this was the trend 2 decades ago about buying up medical practices, because that's why you have primary care, is to actually feed the beast for the specialties. And if you have those doctors. Now, the reality is that there's been all this movement and all these products and all this kind of venture investment into digital health, but nobody believes. I've had health system executives frankly laugh in the face of that. Like, that's cute. You guys go do that. We're going to do what actually drives our business, which is network and talk about quality and ACOs and all these other things. And so I just think they're wrong. I'm not saying that they have been proven wrong. I think the onus is on us to actually show that, but I just think they're fundamentally wrong. Now, I think if you're being charitable to their side, they've said, you've been saying that for the last 20 years and nobody's shifted this. And that's because we haven't had our Amazon moment. We've had some things stolen from these health systems, but it's things that they have not cared about. Like Hims and Hers and others have stolen highly, acute, highly elective, kind of stigma-oriented things like erectile dysfunction treatments, hair loss, and now a little bit of GLP-1s. But they're like, yeah, that's
Yeah.
fine. That's not real medicine. That's not the surgeries, procedures, volume of the things that drive ours. So they're okay with it. I think that's what's starting
Yeah.
to change is if you can actually change that dynamic, then you can show that for these healthcare systems, doing something impactful, and we'll talk about what I think that is, could really change the way that healthcare is delivered.
It's amazing. The ability to have this reality check, which everyone knows under the surface on the health system side, I feel like, to your point, we have to have the conversation here. And I imagine a lot of that, I mean, from what I understand, from what I know about amenities, a lot of those realities drove not only the creation of the platform, but where it originally was targeted, but also where it has pivoted recently. So let's walk through that story, like the amenities story. What's worth kind of recapping for those who are familiar and those who aren't about what you built, and then we'll get into kind of how you pivoted.
Yeah. So the story starts at my time at Baylor Scott and White. So at Baylor pre-COVID, we were doing some things that I'm sure a lot of people have thought of, which is like, wouldn't it be easier if people could get into the system themselves easier? Digital front door, I think it became called in the 2010s. For us, that was two things. It was the website. The websites, by the way, at that time were just non-functional. Even today, like over 50% of health systems, you can't find an appointment on the website, in which case it's like, what are you even there for, right? We did a couple of things that made the website incredibly easy to use and that, again, sound profound, but they were so rare at the time and they were very controversial decisions. So one was we created we actually literally had to go from 200 websites down to one because, again, patient-centric doesn't mean give patients what they need, which is one website to actually find everything. Every doctor, every clinic wanted their own website because of their control of that. And so we literally had 200 plus website when I first started at Baylor. So one was just silliness, get that out of the way, go down to one. The second one was take all the provider search, which again, there were 8 different provider search. That's a more bureaucratic problem, consolidate them. And then 2 was what's the sort order when you search for something? I can't tell you how controversial that was, but I think people understand like old internet searches, like search is everything, right? But like doctors had strong thoughts. And so to make it fair, we just said initially sort by geography, just radius distance to you. And people are, again, very upset if there was like an independent group who was less closely aligned that was actually closer physically. Why do they get to be ahead? Silly stuff like that. But then finally, we did what I was really trying to do, which is sort by next available appointment. Because what does a patient want? They want the earliest appointment when they search for primary care or orthopedics or whatever it was. That was, again, unheard of back in the day. And now, again, we see about 10, 15, 20% of health systems doing that. And it's delightful. I mean, again, if you're a patient, what are you coming in there to look for is to get an appointment with a doctor. And so that was kind of one example of saying, okay, how do we actually start doing things that are against our individual interests, but are for patients? The other was the big MyBSW Health app, which is a big, massive investment to, frankly, overlay the MyChart experience and really build ease of access, helping patients register a brand new account into Epic and MyChart in under 30 seconds with no data entry, helping them find that doctor, all that kind of same stuff, organize all the same day appointments in one place. So things in hindsight that don't look very controversial were unfortunately very controversial. And then so when I first left Baylor Scott and White, by the way, the MyBSW Health app and the website are massively profitable for healthcare for Baylor Scott and White. They are printing money in the sense that 70% of the app users are commercially insured. The profitability of an app user versus non-app user is 6-1. And unfortunately, no other health system in the country is going to have an experience the same anymore because the powers that be, the large legacy EMRs that all these health systems use, are fundamentally not in favor of health systems building their own experiences. And so that has really become a challenge for every other health system. Baylor's pretty far along this journey, but unfortunately, we've seen a backfall of a lot of others. And that's one thing we learned in that journey that you're just mentioning is when I left Baylor first, I was, I think, pretty well known for a lot of these things. And so helped a couple of health systems do that. But eventually, I think it became clear 2 things. One was there's a lot of pushback, a lot of infrastructure and IT programs that are saying, why don't we just use what we already bought off the shelf? Why are we doing all this customization? I've given you all my reasons why, but not everybody agrees. Again, highly controversial. But the second thing I learned, which has nothing to do with the EMR, is Man, it is the Swiss cheese of things that have to happen for health systems to get value out of all of those very controversial, high political capital investment decisions is so high. And I didn't realize at the time how many of those decisions I was making, but I just described some to you. Like sorting by next available appointment, I made that call. We just did it. I didn't ask anybody, just turned it on and whatever. I didn't get fired. I had other options in my career, so I was fine with it. But like, there's so many things that were so bureaucratic in other places, they just wouldn't make the same decisions. And so selling health systems technology was just not working fundamentally. Like we weren't getting the same outcomes that Baylor was. And a lot of that was cultural and the speed to market and the decision making and prioritization of patient needs versus others. So I think ultimately what we pivoted back to, which was actually always my original intent, because I think at Baylor, we really solved like, how do you get patients in the door? How do you get customer acquisition that doesn't cost paying for Google, paying for all of this other stuff, right?
Mm-hmm.
But what we had not touched at all, and I was really set to go solve for, was how do we create loyalty? And I'll tell you why I thought loyalty was the right question to be asked here, because the idea was that I think a couple of fundamental things that always drove me crazy in healthcare, and my kind of observation as it from McKinsey and from the outside in, was one, the lifetime value of a patient in US healthcare is larger than anything I can think of, any industry. It is at least $500,000 to $1 million on average. Because if you just think about like what all of your insurance will pay for every year of your life, all the way to Medicare, all the way to your grave. And large healthcare systems in the US not only can serve you literally from cradle to grave, but they largely they get like 47 cents out of the dollar, like goes downstream to a provider. There's all the kind of feed off to administrative costs and insurance and blah. But the majority of the bulk of the cost goes down to a provider, and it's large healthcare systems. So that's largest like lifetime value of any industry besides like private yacht sales. And yet, do we treat anyone like they're a luxury bag of money walking around? Like we should. I'm not saying that's right or that's the way to think about healthcare. I'm just saying like financially we should, and we don't. We're like the post office. We're like actively trying to piss off every patient that walks in front of our doors, right? Like, oh, sorry, we closed at 4:45 today. Sorry, there's a $50 charge for not showing up. Sorry, we're, back to us, back to us, back to us, back to us. This is how we like to operate. And that is insane. I just don't think it's sustainable. I think now the good news is because that is the ubiquitous experience, everybody's that bad. If you just found one place that did it differently, one place, one website that said, you know what, we'll ship it to you. And if you don't like it, we'll pay to ship it back. By the way, we'll ship it in 2 days for free. You don't have to pay for the expedited shipping, 2-day shipping, free returns. Transformed my behavior completely with e-commerce, right? Because they said, finally, what do you want? Not what do we want? And that's where I think that, like, if a health system gets on the side of the patient and say, what do you want? Not what do we want? Then it's going to be transformative. And they're going to all of a sudden drive, 10% more downstream volume, 20%. And in DFW alone, 10% of downstream volume is $1 billion to a health system.
I bet.
And again, they're just not even trying. That's what I get so frustrated when I'm like, why aren't you making this better for patients? They just don't believe that patients will move in their volume and their behaviors. And that's the only fundamental answer. So we pivoted to this question of how do we solve for real loyalty with a differentiated offer? And what that has looked like, and this is learnings along the way, was one, start with the premium market. I mean, it's not like I didn't grow up thinking I want to create rich people medicine, but health systems need commercially insured lives and higher income patients. And that's what they're prioritizing right now, especially since the One Big Beautiful Bill kind of blew a $32 billion hole in the industry this year. And so we are getting a lot of traction when people, one, health systems are finally looking at like, how do we attract new premium revenue? And two, we can't do it ourselves. Somebody's just better at this. And I think we are really fitting that need with turnkey concierge memberships that generate new revenue for patients or for our health system partners.
There's a lot to dig into, and I'm already thinking about a LinkedIn conversation that I've had recently. In this case, it was a question about ChatGPT health. A lot of the questions we're hearing lately about is that effective? Is it safe? From the health system standpoint, do we like this? Or what do we do? And it turned into I think a useful part of that conversation, which was from the health system's view, they treat the clinical relationship in some ways as almost like I'm the doctor. It's my relationship. That's why I'm not even going to call them a consumer. I'm going to call them a patient. They're my patient. It's my relationship with them. And there's a certain level of sanctity that has kind of been assigned to that relationship in some aspects, but then it never translates to what you're describing. It never translates to let's treat them well. Let's make the experience easier and more convenient for them so that they actually engage in this relationship so that a patient actually does that or actually thinks about us as a source of any kind of useful education or information in between. We can spend hours talking about the ways that health systems could engage a consumer in between being actively seen as a patient. So the fact that you've been able to pivot from that whole conversation and see an entirely kind of a blue ocean here, I feel like, of being able to take that in a different direction is fascinating to me. I wonder if I can dig in a little bit more about kind of how that works or like what the offering is for that premium market.
Yeah. Yeah, let's talk about that because back to this, like we try to, the principles are the principles, and I am not immune to being bad at the principles. So when I first left and was designing these memberships, I said, what does a membership look like? And it was funny, at Baylor, there was a ton of leadership who wanted home to be the future. Like home is the future of healthcare. And so we were just like, okay, we're a home-based membership because I wanted to connect those dots, right? As a first customer when I was trying to get Baylor signed on. And what's funny though is I found a way to quickly test a lot of things with a lot of numbers because one thing is we rely a lot on anecdotes, and just to be very blunt, every single executive should throw out their opinion of what they think healthcare like because they have a fast back phone number to a doctor. And
Yeah.
the public doesn't. And so you are not a normal consumer of anything when you are in the industry. And so we would always try to make sure that we were getting a large and like 50 patients, 100. Sometimes we did 500 patient surveys of an area with no, like this is coming from the health system, no bias. You just like tell us what you think when we ask these questions. And we just started feature testing things. And one thing that we learned pretty quickly in that example was all the home stuff was dead last out of everything we tested. So we were like, oh man, I'm so glad I didn't just build a whole business around a home-based membership when it just underperformed clearly. Now, what we learned on the opposite end of the spectrum is the number one problem in healthcare, I want to be very clear, is cost. For every patient, the number one problem, all the solutions that did the top were financial protections for surprise billing, transparent cash pay pricing, actual data on the financial affordability of different doctors and how they practice medicine. Now, the problem was when I tried to offer a financial package membership to health systems, not a one of them wanted it. So I'm being very blunt,
Interesting.
transparent to say I
Yeah.
tried for a year I talked to 100 different health systems about a financial package that we could build that would be $9 a month, very low cost, would be hugely differential, very much aligned to fix the problems that are most salient for patients, like fixing Amazon Fix, 2-day shipping, free returns, right? And they wanted no part of it because health systems are frankly just not really that concerned about the financial. Everybody, it's not just health system. Everybody, as much as they pay lip service to affordability and stuff, everybody's dollars are going up and they want to keep it that way. And so that was unfortunate. But look, I got to make a business for the reality of this. But what everybody was interested in and patients was a premium experience. Now, back to your question exactly, which is here's what we learned, which is we want to make sure before we said what's in a membership, because again, you see, I test everything from financial solutions to access to experience to the location, home, remote patient monitoring, genetic testing, everything. I was just like curious, what do patients want? And that I could reasonably provide in the unit economics that makes sense. And here's the top 5 things in primary care that we really started focusing on primary care because we wanted it to be a broad inlet to a lot of patients, not just a kind of very niche product. But the top 5 things are so incredibly consistent in every market. And we've done this about 25 different markets with several hundred in each market we tested. Number one, and this is a terrifying indictment of all of us, the number one problem and priority for primary care is I don't feel listened to. Like, how terrifying is that? In every survey response, the top pain point is I don't feel listened to. Number 2, 3, 4, 5 are almost always I feel rushed in every appointment. I don't get timely access. I see a different provider every time. And none of this is about prevention wellness. This is all just reactive to something that I brought in. And so we realized that, oh my God, everybody wants concierge care. They just don't know that's the name of it. Because this is impossible to fix with by-minute visits. That's what I saw that immediately, and kind of like my McKinsey brain went, can't fix that. You can't fix that with 3,000 panel sizes. People want more time with a consistent doctor. And so we simplified the offering entirely. And now our offering is concierge primary care is 60-minute intake. So you get to know this provider and you feel heard. 30-minute regular schedule appointments so you never feel rushed following up, 2 hours of same day availability so you have timely access with this same provider, not a team-based care, not APPs, not nurse physician extenders. And it is very much focused on regular check-ins about wellness, prevention, longevity, functional medicine, integrative care, all these topics that are frankly, I think, garnering a ton of attention because people are burned out by this. Okay, I only get to see that doc for 3 seconds about my tummy ache, but I forgot to tell him my back's been hurting for 3 months, kind of thing. And so and that's it. It's as simple as that. We created a concierge program that we think is scalable at a much lower price point than typical. So typical concierge in this country is $3,000 to $5,000 a year, all up front, all lump sum, only in person. And we think that we can do everything I just described: 60-minute intake, 30-minute regular schedule appointments, and 2 hours same day availability virtually for $99 a month. And so we're trying to not just bring
Amazing.
that price point down to something that we think that 1 in 4 patients would happily pay to get out of this rat race of current healthcare, but higher in commercial insurance patients, higher in higher income, and then also typically higher in these health systems' current patient panels because we ask them where they've been. And that's because these health systems have great brand reputation, but they have terrible primary care access. So current patients, even if they have a current PCP, are like, I'd pay for that tomorrow. And so up to
Yeah.
50% plus in some of we've actually had a recent health system, we found out it was 80% of their current patients responded, said, I'd buy that tomorrow if you offered it. And so those are the types of things we're
Amazing.
trying to take to them and say, hey, not only will we stand up this compelling offering that brings in new volume, very attractive, differentiated service, we'll give you half. Like that I think is that back to this good business is we will give the health
Nice.
system $50 out of every $100 we make there and just give them that. We sell a membership for 1 month. We take $100 in, we give them 50 the next month. I don't know any other business that's offering them 50% of our revenues back to the health system partner. But I think that's what their brand is worth. That is the benefit of not having to compete with hims and hers for customer acquisition. That is the value of not just the higher conversions because I'm using a big name brand, but also it is the benefit of having a safe place to send them for downstream. So all of my specialty, pharmacy, imaging labs, et cetera, go to a known entity that we can coordinate care with. So that's what we're designing. I hope one day we can bring that price down, but right now it's, I think, still a compelling offer in the market to offer a completely differentiated experience. And the last thing I'll say is that now this is one where I'm probably not listening to the research as much as I am like with my gut and my intuition, my personal experience, which is I think when COVID happened, we had this amazing moment for virtual care and we did it all wrong. We made it secondary, less than in person. We're like, oh, we can't wait to get you back to the office. I feel like virtual should have been a luxury. And it's not because of the technology itself. It's that it starts on time, it ends on time. I don't have to drive. I don't have to sit next to 18 people coughing in a waiting room. Like just those alone is a better experience than traditional care. And so I want it to be positioned as a luxury, not as a deficit or less than the in-person concierge. So don't knock anybody if they still want the in-person, and we often sell that alongside that. The health system's current in-person concierge program, we try to grow that as well. But we really want to position virtual and the ability for you to have a one-on-one relationship with a consistent doctor for the next 5-10 years. That is, I think, what we're selling.
I have so many questions about how to keep going in that direction, especially in the visits that are prevention focused. We are close to time today, but let's do a part two very, very soon because I could ask a whole second segment about that and the not only the strategy behind it, but the traction you're seeing and the growth that you're seeing there, because I do think that's the future. I absolutely think that's the future, especially as we look at demographics. I mean, but again, this is from the consumer's point of view, not from the health system's point of view. The fact that you can that this offering can come. I mean, we've spent the last probably 3 years on this show inviting founders on who are offering virtual memberships of some kind or another, a functional medicine membership, a nutrition based membership, a longevity based membership, but none of them are connected at all to the health system. And so that was one of the pieces of the puzzle of always, okay, well, cool, like you're basically choosing that instead of any relationship with
Instead of
the
it,
you know right. And so I think there's an and, not an or, like in the future, like where you do both. I mean, and clearly I think that's the direction that this is. So yeah, this is it's mind blowing in one sense that there are folks like yourself who are addressing this, who are acknowledging the realities and are saying, yeah, look at what's available now. Like, look what we can do. Look at the price point. It works. So I think it's tremendous here. I guess just my last question for today, and again, we'll have you on very soon again. For other founders in the space who have had some inkling of this, are looking at, I've sensed the same thing. I've experienced it the same myself. I want to do something about it. What's your advice to fellow founders in this space who are maybe thinking about building something in the same direction?
Well, I think a lot of founder journeys are different, but in healthcare, and especially the segment of healthcare that I work, I think one, you're hearing a bias towards health systems, which, God help me, is a sickness. I wish I didn't have it. It's just, you heard it's my whole background. I used to work with large healthcare systems. McKinsey, was an executive. That, I think, gives me both a unique insight and responsibility to a very pragmatic solution that you just referenced. Like, how do you bring them in? How do you make something win-win for them? By the way, we have not gotten over that. The number one challenge I get from health systems, because I'm like, I'll give you bags of money, I'll create better access, I'll improve your brand loyalty, and I'll feed downstream high dollar surgeries. They're like, yeah, but our primary care isn't going to like this. And I get stuck. I mean, so I haven't solved for everything. I mean, there's a protectionism in the industry that is challenging. Don't be oblivious to that, meaning you have to understand those nuances. Like, I knew that going in, though. That wasn't a shocker to me. I'm still figuring out how to go around it. And I think there's a couple of answers we could talk about next time. But if you're a founder, and especially if you're going to get in something as bureaucratic as healthcare, having that reality, like if you found that out 8 months in, that would be a problem, right? Like, that's where, like, oh, I can't believe the PCPs don't want me to take their patients from them. So you can't be naive. That's one thing. Like, just, you can't be naive. You need to have some homework, or have somebody that can tell you what's really happening. I really appreciate you recognizing, like, I don't sugarcoat decisions. Hopefully I'm telling you what everybody is observing. I'm just telling you why, because they're like, but they have a chief patient experience officer. They always say things like patient-centric care. I'm like, they don't mean it. And so one is being a realist. And then the second one is then the conviction to stick it through, man, because these are painful. These are 18-month sales cycles with these folks. And if you don't have conviction, which you can see, this is a professional thesis, not just a company. It's happening to manifest as a company, but I want to fix this for U.S. healthcare. So I'm willing to take a lot of pain for that. And that's the second piece of advice. Like, if you, once you find that conviction, you got to see some pain through. Because I try to tell my kids, hard things are hard because they're hard and they're important. Just, you got to see it through with everything. Very few things are going to be this rocket ship. Healthcare is not built for unicorns. There's so many things against it. And if you have that in your head, like, if I don't see 180% growth I must be failing. Like, that's just, you're starting off with the wrong expectation. Hard things are hard. Important things are hard.
It's a perfect place for us to wrap up. And thanks for everything you're doing in this space to make healthcare more actually consumer and patient-centered. And wishing you the best of luck on that journey. Thanks for giving us a few minutes today.
It was great chatting with you. Look forward to the next one, Derek.